do that, and then from the beginning, I'm gonna do, Peggy, if I'm making a mistake, let me know here.
Right to me. Very good.
From beginning, and then why isn't the header going away? Resume slideshow. There we go.
Very
Okay, so can you all see the slides and me, or just the slides, or?
I can see the slides, and then I have a grouping of people down the side here.
Okay, okay, good. Okay, so Peggy's going to get going with the first half, and then I'll pick it up in the middle when it comes to isolation and contact tracing.
All right. So, and we already kind of introduced ourselves. So yes, thank you. So coronavirus disease 2019. So SARS-CoV-2 infection. What SARS stands for is actually severe acute respiratory syndrome. And we now know a lot more about it than we had when this first came on the scene back in the start of the year. We know it's transmitted by respiratory droplets, and that can occur with coughing, sneezing, singing, talking, or even with breathing, heavy breathing. And because of that, we know that masks do reduce the transmission of the spread of the virus, as well as protect against infection. And the recommendation is that masks be worn, and that masks that you choose are actually multiple layers. So if you'll next slide, then it is considered a very contagious respiratory illness. And the signs and symptoms that can be seen, although it doesn't seem like any two individuals have the same signs and symptoms, is that cough, the fever, and it's a dry cough, fever, shortness of breath. Some of these patients who are hospitalized have low oxygen in their blood, even though they don't seem like they're that desperate for breath. You could notice a loss of your taste and or your smell, a runny nose, headache. Some individuals just have the GI symptoms, the nausea, the vomiting, and the diarrhea. And you can also have a sore throat with chills. However, it must be said that a significant number of individuals are asymptomatic. They have no symptoms at all. And upwards of 40% of individuals do not demonstrate any symptoms that they are infected. However, they can indeed be spreaders of the virus. The way that we determine whether or not somebody has infection with COVID-19 virus is to do testing. And there are different ways of doing the testing. We can do rapid testing, and this is also called point of care, meaning that the test is done right then and right there, whether it be in the clinic or the physician's office, hospital emergency room. Those results are usually available within an hour. The test itself is either done through a throat or a nasal swab. And this rapid test is considered to be most effective at identifying somebody who is COVID-19 infection positive when the testing is done during the early stages of the infection. And the reason for that is that's when the viral load is the greatest. So we'll see, again, it's at the early stage of when somebody is newly infected that we see a greater positivity rate in terms of the rapid testing. We also can do PCR testing. PCR stands for polymerase chain reaction. What it does is it looks for the molecular or the genetic material from the virus. This is also done with a nasal swab, but it may take days for the results to come in. There are times when we suspect that somebody does indeed have COVID-19 infection, but yet the result on the rapid test is negative. So that would be your false negative result. And when that occurs, and when the patient is indeed symptomatic, the individual, we will confirm with a PCR test, confirm the rapid test results. There have been numbers of times that individuals test negative rapidly, but then their PCR is positive. And the next slide, and it'll be available for you on our website, the health department website, which is listed as a reference at the end of this presentation. There are free testing is done in LaPorte County in these two facilities here, and you can look at that. Erica?
Okay. All right. Our next focus is going to be the difference between isolation versus quarantine. So isolation is separating a confirmed sick person, and in this case with COVID, we're basing it on lab confirmed, and in some rare circumstances, clinical COVID, which is a lesser percent of the population where it's physician diagnosed clinical COVID. But the majority of people are going to be lab confirmed, known to be contagious with COVID. We're keeping them separate. For the guidelines for COVID, it's a minimum of 10 days. So it's time-based and symptom-based. So 10 days is the minimum. Then at the end of that 10 full days, they have to also meet the criteria of being 24 hours fever-free without fever-reducing medicines. And then also have progressive improvement in their symptoms. There are some gray areas there, such as reduced taste or smell. If somebody did experience that symptom, that can linger on for a while, and that doesn't mean that the person's actively contagious and shedding virus if they actually are feeling better, but just have something like that that still lingers. Quarantining would be, in general, for infectious disease, separating people who are exposed to a known positive person who has a contagious pathogen. The quarantine is keeping that person separate from others to mitigate spread in the community in case that person who was exposed does become sick and then potentially pathogenic to others. And due to the isolating and quarantine being difficult at times, as we're all seeing in the community, this is where we get the huge amount of spread, because these measures really should be followed the best we can as a community. So quarantine, one other thing to note, I mentioned the 10 days about isolation. The current guidance from the CDC is 14 days quarantine, 14 full days from the date of last contact with a confirmed positive COVID patient. So we'll go more into that as the slides go on. And then of course, questions, you can ask all your questions at the end. Okay, contact tracing. Of course, the goal is preventing the spread of infectious disease, identifying the positive cases and their close contacts. During these times, especially with high spread in our community and across the nation, we're really, the messaging we're taking as a health department locally, and the state is also supporting this measure, is that everyone really needs to have personal responsibility, including that positive individual. So for example, our schools, they've really been owning this process ever since the schools got going, identifying or having a good faith reporting where the parents are reporting to the school nurses and the administrators, and they have internal processes that they go through. Also, the recent webcast for local health departments said that our state, they're shifting focus from the state contact tracers to really zero in on the known positive COVID people and making sure that all of them are communicated with from the state level versus spreading out the resources to try to contact every single close contact of every single positive, because it was stretching them thin, and it's really, we're exhausting resources here when we want to make sure we get the most high-risk people, which are the known positives. So one of those expectations, of course, for this audience we're talking to here, in the employer setting, whether it's a non-for-profit or a private organization, there should be strong processes where the employers should have plans in place where employees or volunteers notify through an organized structure of a point person that they either were exposed to somebody or that they are sick themselves or suspected that they might have symptoms, so that we can all act quicker, and the quicker we act, the quicker we can identify and isolate and quarantine as appropriate. People who are sick with COVID-19 can spread it to others. The science has shown up to 2 days before they have symptoms. So that's where your asymptomatic spread can occur as well. So that is why in the contact tracing, we look back 48 hours. And I'll go into that further on the next slides as some of the criteria. And all of this that we are getting is from the CDC guidelines. Let's see here, just looking at my notes real quick. Okay, so really important thing is once you know in your organization, for example, you have someone that called you and said, you know, I have been diagnosed with COVID-19. It's really important to ask them some basic questions. You don't have to go into, in your type of setting, a detailed epidemiological conversation like they might do at the state, where they're doing a lot of questioning to look at data and try to identify hotspots and all of that. Your focus is really, okay, prioritizing protecting your community, your organization right within your population. So if we're all doing that all throughout the county, whether it's the schools or a church or us within the county health department for county employees, if everyone's doing that, that's really going to help have multilateral processes working, doing the same thing. So you would want to ask them just basic questions, and there is some links at the end that give you some of the scripting from the CDC. But you're going to want to ask them the close contacts that they had. I would focus on the workplace. So for example, at the foundation, if you had an event, or at the Swanson Center, you had a meeting, you're going to want to have that person reveal to you, you know, who they were interacting with in your organization, because your responsibility would be to focus on that, mitigating the spread in your facility. Now, the positive COVID person, the messaging from the state is that we want, due to the high spread, we want the positive person to really take ownership and do their due diligence to share their positive results. Hopefully, I mean, some people have different feelings about that, but to let their family members know, to let their outside community exposures, such as maybe the neighbor down the road that they just went and had a gathering with or something like that, that wouldn't really be where you want to exhaust your resources. You and the organizations are going to want to focus on your internal people, and then encourage that person who's positive to they themselves notify other people outside of the organization of who would need to know. So let's see here. As far as, well, once, of course, you know that someone is positive, and then you have identified the close contacts that they have had within your organization within a 48-hour period, that's where we go into that criteria of people where they can be infectious for 2 days back from when they first had symptoms. Now, there are some caveats here where you may get someone who tested positive, they don't even have any symptoms, and maybe they got a test because they felt that they were high risk because they were exposed to somebody outside of work. You didn't know anything about it. Your person at your workplace is calling you saying, I have a positive test, but I'm not symptomatic. In that case, you're going to base that day one as the test date. If somebody has called off of work for a couple days, they haven't been feeling well, they call you and they say, I tested for COVID and it's positive. You're going to want to ask them when their symptoms of COVID really started. So through some of the interviews that I've done, some people do actually have trouble identifying that day one of when their symptoms really started, because people have to recall, you know, sometimes people have allergies, or maybe they just normally have allergies or some funky things going on during this time of year. So really kind of helping them figure out, okay, when was your day when you just really knew you felt your body just felt off? You just didn't feel like yourself. You either had extreme fatigue or you spiked a fever or something like that, to try to help them identify what their day one is. And then for that symptomatic person, that day one, you go back 48 hours from that day. So of course, towards the end, I can answer more questions, and there's also links to back all this up, since it's a lot of information to take in at once. Once you get those names from the person, of course, it's really important to ensure, you know, we're not going to be telling anyone else that it was you who was positive, but we are going to let people in the organization or in our whatever function you may have had, we're going to let them know that they were exposed to someone who was a confirmed positive. So then when you notify those people, that's how you're protecting HIPAA. I know that was a question that had come up from some of the organizations in the community. So you don't have to reveal any names, and our schools have been doing a great job of this process all throughout the school year so far, of having really rigorous process of getting that messaging out to others who were potential contacts while protecting the name of the positive. Of course, it's always encouraged to refer the close contacts for testing and to give them the information on the slides of where they can get testing. Encourage the close contacts to monitor for signs and symptoms at home. And there's guidance on CDC of what to look for as well, monitoring for fever, things like that. Let's see, of course, someone who's going to be going into a quarantine period, you know, making sure that they're okay, just having that human to human connection, trying to help them the best you can. Like, are you going to be able to get groceries? Because in order for them to truly fulfill the real quarantine of staying out of contact with others in the society and staying at home, they're going to have barriers, as you know. So really trying to help connect them with services or any help they might need to fulfill quarantine properly. Contact tracing in general, it's a multifaceted process where we're all taking part in doing this, everyone from the state level to the local to the schools to individual organizations. So, and including the positive people, we all need to play a part because we're in this together with how large of a spread this is and how vast it is. We need to all pull resources together to accomplish it. So something that was recommended from the CDC is to identify a point person in your organization or office. In your type of setting or in many. So for example, the schools are using the school nurses and the administrators. Not all of our schools actually have nurses present. So some of the parochials have the school principal doing it, and they've been having to educate themselves. And of course they call and they'll ask me questions for guidance. And we're here if you guys have questions, I can answer questions, but they've been really reading the guidelines and then following it themselves. And if they get stuck, because there's certainly areas of gray, nothing's black and white when you get into some of these, we're here to help answer questions with that. But having a point person, so in a private business, an HR department is often one that will own that. Or maybe in a, let's see, I wrote some other notes here, in the foundation or a Swanson Center. I don't know if there's, you know, a particular nursing group that can help, or however you guys want to structure it, but making sure that the information is flowing up to one or a few people that can own it. That way it's streamlined and simple, and that there's not duplicate work, and that it's clear and concise so things are followed properly. So that's part of developing the plan. Let's see, once I'm just reading this last part of the slide here. Oh yes, of course, the bottom main drive home point here is in your organization, you guys are responsible to contact those individuals who have been deemed a close contact when it's something related to your organization. So for example, if you have an employee that told you they were sick and you know there was a meeting and there were other people in your organization that were exposed and you hosted this event or meeting, you have to take that due diligence of helping to facilitate that communication while still protecting the privacy of the person who's positive. But for example, you are not expected to ask that person all of their contacts outside in their private life. You don't have to worry about that. We are asking that they do their due diligence, and the state also reaches out to contact them as well. There is a lag from the ISDH because of the increase in amount of testing, the increased amount of contact tracing. So they really want everyone to kind of work together from their own focus point of what's controllable within their own realm. So the dates are really important because that's where we get into that 48 hours. So in that conversation that you're going to have with the person, determining that, either when the signs and symptoms began, if they are symptomatic, or when they actually had their test date, if they are asymptomatic. And that's how you're going to determine their time that they need to be off work, if they are a positive, when they can return to work. Then if they are a close contact and they are a part of your organization, that will also be important for their time that they're given and then when they can return to work. The CDC actually, I should say the ISDH, coronavirus.in.org, our main dashboard that has our Indiana map. They have some excellent resources, which we can also tack on to the end of the PowerPoint, that have 2 resources you can hand out to employees or volunteers or whoever your population is, that gives exact guidelines of what it means to truly quarantine. And it also gives examples with a calendar so that when you are explaining this to them, you have a calendar with a visual to show the rationale for it. Same thing for isolation. So we've got 2 really good documents that actually our school nurses and admin have been giving out to their population when they have to order the isolation or quarantine. So the last thing here that says, okay, for do not return to work for 14 days, that would be for a close contact. If they go out and get a test, I think this actually goes onto the next slide here about testing. So, sorry, I had an interruption there. So quarantining and isolation, ultimate goal is to stop the spread, to do the best we can to stop the spread in the community. Determining close contacts, this guidance that we get from the CDC is, these numbers are certainly, they seem to be set in stone, but you also need to apply some critical thinking and judgment for areas of gray. So for example, the basic guideline is a close contact is someone within 6 feet or less for more than 15 minutes, cumulatively in 24 hours, even if they're wearing a mask or not. So for example, let's say that somebody was like, well, I was around this person, we were talking over at the break room and we were like 7 feet apart, but we took our masks off and it was about 10 minutes, but we were talking face to face. You know, I would err on the side of caution, and I would assume that person is a close contact. The CDC just put these basic fundamentals in there to have something to help people, to guide you on how to determine what is considered a high risk close interaction and what is not. So if someone walks by a desk and they're carrying a stack of papers, they have a mask on, they drop the papers off, they say to someone, good morning, how are you? They're about 6 feet apart. They really don't interact very much. And then later on the day, maybe they do that again. It's a couple minutes here and there. Those are low risk activities. Certainly, if you have a question on what would be meeting that criteria, I can take calls to help. When the nurses were first learning this in the schools and the principals, I was helping to guide them through some of that. And whenever we get conflicting information, I always tell them err on the side of caution. You're better off being cautious and assuming they're a close contact when it gets down to the nitty gritty. So let's see here. Okay, so of course, how to quarantine. These are the guidelines of what it means to truly quarantine for the 14 days. And in the document that we're going to link, it'll explain all of this so that when you hand that out to people you may have to order quarantine for in your workplace or organization, that will really help. But truly staying around others, hand hygiene is very important, wearing the face covering around others, doing their best to separate from others in the household, not sharing personal items, having a separate bathroom if possible, separate eating area as well. Let's see. Oh, yes, this is also really important about testing and the time frame. So for someone who is really feeling sick, they have this fever, they've got that feeling, they're like, you know what, I have some of these classic signs of COVID. You should encourage them. If they've called off, they said they don't feel well, let them know about the testing centers and encourage that. If someone has been deemed as a close contact, let's say today you say to someone, hey, you've been exposed to someone that is a known positive COVID. We need to have you quarantined from work for 14 days. You give them the information, you tell them about testing. have them monitor themselves for a fever and other symptoms that may occur if they did get the infection. They should not go out and jump to testing right away. There have been some people that have done that, and it has caused, you know, somewhat of, it's contributing to the backlog in testing, because certainly we want people to test, but there's a prime time when they should be testing and when they shouldn't be. So Dr. Weaver and Dr. Box, the chief medical officers at the state at ISDH, have said the prime time to test when you are a close contact is 5 days. The rationale is because that gives time for the virus, if they did get infected, to actually start incubating and then show a positive if they really are going to become sick. Because if they go test on day 1 and it's negative, that doesn't mean they're out of the woodwork, nor does it mean they're out of quarantine either. So a negative test, even if they got a negative test after 5 days, it still does not mean they can get out of that quarantine for 14 days. So the 14 days is 14 days. Transparency, this slide is really just kind of wrapping up the concept that we're all in this together. Also, that proactive communication is really important during these times. I wrote a few notes here to, hold on one second, some thoughts that I had on this. Okay, so being proactive, from what I have learned going through all of this, can really help to mitigate fears in the community and in your population of your organization. It can dispel rumors or misinformation that will occur when people don't know what's going on. So for example, if a place has to temporarily shut down due to operational issues because you had to quarantine so many people that you're going to convert to a temporary physical shutdown and go virtual, it's good for there to be proactive communication stating the rationale of why your organization made that decision. And then say, you know, we will be back after this many days, once you know your quarantine time being over for your group, and say, you know, we will see you again soon. We're doing this as a proactive measure due to the number of quarantines we had to issue for our group. Then people also know there's not some huge outbreak of COVID in your organization, that it's really just because you're following those safety guidelines. So it can actually help to prevent misinformation, fears, talk among the community. You know, we're always going to have that, but the more we can try to proactively communicate, the better. So that's really, I think, that's the last one, but that's kind of the general overview of contact tracing and all playing a part in that. Peggy, do you have anything else that I missed, or?
No, I don't. I wondered, and there's one last slide too for.
After the resource. Oh, this one?
So we have, yeah, so we have that contact tracing hotline if they had any questions. And of course, if they have any questions, they can call either yourself or myself, and you can contact us through the health department, and that would be 219-326-6808, extension 2200, and ask for either one of us, or get a message to us, and we will surely call you back in a timely fashion.
Okay. Should I stop sharing the screen so we can see each other? I can't see anybody, so I'm going to stop.